Hi everyone, this is the Chapter 25 Musculoskeletal System. Here are your learning outcomes. And just your A&P overview. Your book does a good job of that. So special considerations that we're going to be going over: age, developmental, race, ethnicity, work and living conditions. So if you look over the Goals for Healthy People 2020, most of them focus on arthritis and the patient's ability to maintain their independence and be pain-free with arthritis. Also, the prevention and screening for osteoporosis, and also reducing the number of people that have chronic back conditions. So you can read over those. All right, lifespan considerations. Infants, we need to make sure that we are assessing them from spontaneous movements. There can be some congenital neural tube defects such as spina bifida, but we need to remember that infants and children are growing very fast, and that their long bones and joints are more likely to fracture than to sprain. So that's about it for infants and children. You'll get more in your peds. Pregnant female, there is going to be a lot of changes in the cartilage, in the pelvis softens, strain in the lower spine can happen, causing lordosis. The older adult, there are going to be changes in the bones, muscles, joints, connective tissue. There is also a decreased calcium absorption, which can lead to osteoporosis. And let's see, height generally decreases from 1 to 2 inches after somebody is in their mid-20s through their 70s. And this is the result of the shortening vertebral column. So also with the musculoskeletal system, older people have a decreased reaction time. The speed of their movement is slower, agility is less, and there's less endurance also. So, like I said, with pregnant women, they may be prone to lordosis, and this is an abnormal curvature of the lumbar part of the spine. And kyphosis on the left is something that is common with older people, and it's where you have an abnormal curvature of the thoracic spine. So some of the psychological considerations we need to think about are impaired mobility and the problems of self-esteem, social isolation, and anything that is going to cause inactivity can lead or trigger some of these psychological disturbances. So we need to make sure we take that into consideration. Also, it's important to think about physical abuse or the possibility of it if a patient has a history of frequent fractures, sprains, or musculoskeletal trauma. So other considerations, race and ethnicity. Actually, Africans do have a higher bone density, so they typically have fewer fractures. Osteoporosis is more common in women, especially Asian and Caucasian women. With the cultural groups, the curvature of some of the long bones can vary among cultural groups related to genetics, so we need to keep that in mind. Diet and weight are huge factors because obesity is linked to lumbar back pain. Work, we need to make sure that we're assessing our patients for what kind of work do they do. Do they do a lot of heavy lifting? Somebody in construction or athletes are going to be at a higher risk for sprains and for fractures. Also, repetitive movements, work that would cause somebody to be sitting for long periods of time, working on the computer, things like carpal tunnel syndrome come to mind. So your focused interview, you're going to be looking for, what the normals are, and consider your patient's ability to participate, obviously, and we're going to put our attention on the focus of relief of discomfort and symptoms, especially if the patient is having acute pain. So, focused interview, some general questions. We want to know if there's been any changes in their mobility. Are they able to perform all their ADLs, all their activities that they normally do? Are there any illnesses, infections, or injuries related to the musculoskeletal system? Things such as arthritis, fibromyalgia, diabetes can lead to osteomyelitis, which is an infection in the bone. So we need to make sure that we're asking our patients about that. Symptoms, we want to know if they have any redness, swelling, pain, or stiffness in any of their long bones or their joints. Age, we talked about. Pregnancy, lower back pain is something that's common. Older adults, we have to remember that they may experience some weakness. They may have some falls. Do they use a cane? Do they use a walker? With the environment, you've got internal things such as weight loss or gain. Diet and exercise are going to have a big impact on this. Also, do they smoke? External sun exposure for vitamin D. And why do we need vitamin D? You should know that. What kind of work environment and what are their hobbies and activities? So also for family history, you want to know if they have a family history of any musculoskeletal abnormalities, but also are there any things such as rheumatoid arthritis or autoimmune disorders, because that can also affect somebody's risk for developing arthritis. So the first thing we're going to do when we look at the musculoskeletal system is we're going to inspect. We're going to be looking at the long bones, muscles. Is there any muscle atrophy or wasting? We're looking at the joints for any deformities, and then we also are going to be palpating for any tenderness or pain. We're going to be doing some assessing some range of motion, but only those joints that are listed on your practice rubric. So this picture here is something that you want to be looking at. You need to look at the patient's spine. And what you're looking for is the top of the scapula and the top of the iliac crest should be straight. If the spine is straight. If the spine is not straight, such as this case, you'll notice that the scapula and the iliac crest are not level. I'm going to talk a little bit more about that when we talk about back problems and scoliosis. So with muscle strength, it's going to be the same as your neuro assessment. You have your upper extremities and your lower extremities that you're going to be assessing for muscle strength. And again, it's 0 to +5. So this is your documentation. I will be videotaping your musculoskeletal practice, but again, just practice those joints that are listed on your practice rubric. And that is all I have for musculoskeletal.